Dear audience, let me present you my PhD studies, which is about the applications of dietary fibers in patients with metabolic disorders. My name is Evelin Juhász, and I graduated as a dietitian, and now I'm a PhD student at the Doctoral School of Health Sciences. My vision is to normalize the metabolic disorders of the patients by receiving dietary fiber instead of taking a medication, and my mission is to draw attention of the physicians to the results of the studies regarding the dietary management of polycystic ovarian syndrome. Here you can see the 3 projects what we are working on. With the first project, we would like to rank the effects of different types of dietary fibers on glycemic control and lipid profile in patients with type 2 diabetes. With the second project, we would like to investigate the most effective dietary approach in women with polycystic ovarian syndrome. And based on these 2 studies results, we would like to perform a randomized control trial. So our first project title is the galactomannan is the most effective soluble dietary fiber in type 2 diabetes. Just a quick background about the topic. 6.28% of the world's population has type 2 diabetes, which is a quite high number. And based on the previous studies, dietary fibers could be a good solution for control hyperglycemia or hyperlipidemia. But what are these dietary fibers? Fibers means carbohydrate polymers with 3 or more monomeric units, which are neither digested or absorbed in the human small intestine. Traditionally, dietary fibers are classified as soluble and non-soluble dietary fibers. Generally, soluble dietary fibers could slow digestion and could prevent some cholesterol from being broken down and digested. And non-soluble dietary fibers could prevent constipation or reduce bowel movements. And I would like to emphasize that using dietary fibers is a gap in the diabetes guidelines. So our aim is to investigate the effects of dietary fiber supplementation on glycemic control and lipid profile in patients with type 2 diabetes. Our clinical question was, does dietary fiber intake decrease the hemoglobin 1c level compared to another type of dietary fiber or no dietary fiber intake? We conclude patients with type 2 diabetes. The intervention and comparators were the same, soluble, non-soluble dietary fiber and no fibers, and the outcomes were the glycemic and lipid factors. Our hypothesis was soluble dietary fiber intake can normalize glucose and lipid levels in patients with type 2 diabetes. We did a systematic search in October, and here you can see the PRISMA flowchart. Our main outcome was the hemoglobin 1c level. On the A graph, you can see a network. This network included 12 different types of interventions. The size of the nodes is proportional to the number of the studies, and the thickness of the edges is proportional to the number of each direct comparisons. On the B graph, you can see a Sucre curve, which provides a posterior surface under the cumulative ranking curve, which estimates which type of dietary fiber seems to be the most effective on reducing hemoglobin 1c level. And on the C graph, you can see the rankogram. Every dietary fiber has a percentage, and which is closer to 100%. That fiber was the most effective in reducing hemoglobin 1c level. And as you can see here, the galactomannan had the highest effect on reducing this outcome. From the lipid profile, we chose the HDL level outcome. You can see again a network which included 16 types of dietary fibers, a Sucre curve and the rankogram again. And here the gamma arabic was the most effective dietary fiber. This is a summary table of the results regarding to each outcome separately. And you can see the ranked first 3 most effective interventions and the least effective ones. As a conclusion, I would say that galactomannan was the most beneficial intervention for hemoglobin 1c, fasting blood glucose level, triglyceride, and LDL levels, and it has a significant result in almost all the outcomes compared to no fiber. Our studies strengthen that to our knowledge, this is the first network meta-analysis assessing the effects of soluble dietary fibers. It has a rigorous methodology. We could assess 16 types of dietary fibers, and we included almost 3,000 patients. We have limitations as well, the small number of the direct comparisons. Patients get very different doses and formulations of the dietary fibers, and they had various background diets, medications, and lifestyles. As a summary, I would like to emphasize that using dietary fiber is a good solution to increase dietary fiber intake and take advantage of its beneficial effects. And dietary fiber should play a greater role in dietary counseling. And for the future, I suggest for the researchers that they should do further long-term and high-quality RCTs, which explore newer types of dietary fiber, for example, still oligosaccharides. And these effects of dietary fiber should be investigated on other types of disease, for example, PCOS. We would like to submit our paper in the diabetes care, and now we are preparing the manuscript for submission. About the second project, which is effects of different dietary approaches in women with polycystic ovary syndrome. A quick background about the topic. PCOS is one of the most common abnormalities in women of reproductive age. And in the first-line treatment, these patients usually get dietary, exercise, and behavior therapies. But I would like to emphasize that there is no or limited evidence about the specific dietary composition. So that's why our aim is to identify the most effective dietary approach in the treatment of PCOS. Our clinical question was, which dietary approach has the highest effect on normalizing metabolic and hormonal measures in women with PCOS? We concluded women with PCOS. The interventions and comparators were different types of dietary interventions and metformin, and the outcomes were anthropometric, metabolic, and hormonal measures. Our hypothesis was dietary approaches can normalize metabolic and hormonal parameters in women with PCOS. We did a systematic search in May, and you can see the PRISMA flowchart. We have 12 outcomes, but for now we got results for 6. And the minimum criteria of the network analysis couldn't match with the LH and FSH outcomes. So from the glycemic factors, we chose the HOMA index results. You can see again a network graph which includes 6 interventions, 5 dietary interventions, and one of is the metformin, a sucre curve again, and the rankogram. And as you can see, the DASH diet was the most effective to reducing HOMA index. And from the hormonal measures, we chose the total testosterone level. This network includes 7 types of interventions, and here the metformin was the most effective one. And about the third project, which is effectiveness of dietary fiber on the ovarian function and metabolic balance in women with polycystic ovarian syndrome. The background is quite the same as in the second project, but here I would like to highlight that in the first choice treatment, these patients get insulin sensitizers, which has side effects, and that's why we would like to give these patients an alternative treatment. And based on the study's results, we would suggest the dietary fiber. So that's why our aim is to examine the effects of dietary fiber in the treatment of PCOS. About the protocol drafting, we would like to include women with PCOS, and after the randomization, on the A arm they would get galactomannan 1 grams per day, and on the arm B they would get, as a placebo, maltodextrin 1 gram per day. And after the follow-up measurements, we would like to analyze primary outcome, the menstrual cycle normalization, and the secondary outcomes are the glycemic factors, hormonal parameters, lipid factors, and non-alcoholic fatty liver disease. As a summary, I would like to say that we would like to plan, we planning to submit our papers in this autumn. And as a dietitian, I would like to close my presentation with quotes from Hippocrates, that let food be thy medicine and medicine by thy food. Thank you for your attention.
Thank you for your presentation. I just never thought about it before, but for the first one, why did you think that soluble fibers would be better than non-soluble? Because that's what I conclude from your PICO, that since you compared it to non-soluble, that must be inferior to soluble.
Thank you for your question. We conclude the non-soluble dietary fibers to our network meta-analysis, but there weren't enough studies on this fiber, and based on these results, that's why we chose just to include the soluble dietary fibers.
So, and the hypothesis wasn't that it's inferior to, that the non-soluble are inferior to soluble, but you just didn't have enough data to look at those as well. Yeah, thank you.
Congratulations. My question would be regarding your randomized trial protocol, if you can go back a bit. I remember that your control arm was maltodextrin, which is going to be a placebo. But in your aim, you stated out that you would like to give an alternative for glucose or insulin sensitizers like metformin, etc. So why don't you use insulin sensitizer on your control arm, or why don't you compare head-to-head these agents? So I'm not in this topic, I'm just asking that why do you use this?
Thank you for your question. Based on the previous studies, maltodextrin is usually a placebo, and if we would use, for example, metformin, I think the results would be better for the metformin, and we would like to prove that the dietary fiber has a good effect on normalizing these measures.
I would like also just address a question, so that when I read your manuscript, so that the galactomannan, so it's very obvious from your work that it has an advantage. I went on the internet, so it's not so easy to get it anyhow, but do you appreciate you focus on the diabetic patient? Whom would you recommend to take the galactomannan as a daily practice? And how can you get it in Hungary?
As a dietitian, I would say that patients should intake dietary fibers firstly from foods and then from the supplementation. I found it on the internet, so I think they can buy it there.